with smaller communities and smaller workforces, we don't have often that many people within the organisation that have lived experience that we either know about or who are willing to be part of design of policies, programs and services. And so our question was around is there any advice or tips or strategies you have about how we ensure we include the voice of people with lived experience without burdening particular individuals, and also ensuring, obviously one person's voice doesn't necessarily represent the whole community either, and so we run into this struggle where we end up having either the same people involved in the consultations or not at all, because we don't want to keep burdening those people with having to be involved in the design every time. But we're wondering if there was some tips to kind of work towards getting better at that.
I actually think that there are more people than what we think that have actually the capacity to be involved. So what I mean by that is, like, I feel that we work often a lot with the same person, but they are more than what we believe, that actually have the capacity to be community leader and to be involved in the different projects we implement.
For me, in primary prevention, the primary source of lived experience is going to come from research. So research is where, on a large scale, people have gone out and talked to people with lived experience. And in some ways, I believe we have a responsibility to use that first and foremost, rather than asking people the same questions that we can actually get the information elsewhere. Then it focuses the consultation that you might be doing with advocates and with people within your workforces to the things that that are more specific to the particular project or the particular thing. So I think there's a need to really learn as much as you can from any other sources before you actually go and do that broader consultation. In terms of how to do it when you get to that point, I think it's something that's really got to be negotiated. It really depends where people are at, what's happening for them, what other pressures they're under, and sometimes I think having a really explicit conversation and saying, I know that this is putting pressure on you, can we talk about whether you're up for it, what you're up for, how long for, and I'm going to check in with you about how you're going with it as you go along.
Learning from what's out there, whether that's national research or other studies, the publications of different organisations, but then also thinking about how you've planned to do a consultation or how you're planning to do a co-design process, and to think about, are there some assumptions in that could be re-examined, and you could think about doing things in a different way that would make it possible for people to be available and interest to join in. So again, that importance of transparency, thinking about the time commitment, remuneration, other support that would be needed.
How to balance the tension of meaningful relationship building and the time it takes within funding and program streams that are often outcomes focused. We're wondering what is the opportunity for us as a sector to influence change in this structure.
Actually, we've been in that situation recently on one of our projects that is actually a co-design project, what we really call co-design. And the way to deal with it is actually, it's with the leadership. The leadership has to be very strong towards the funding bodies. And so it's a lot of negotiation actually with the funding body, because we started this project with some deliverable, but because we started working with communities and they actually told us, differently, and it takes time because you need to build the trust and all of that. So it's actually, it's a lot of advocacy actually from the leadership. And I think that it's actually about potentially building the capacity of the department. For them to understand better what does intersectionality means.
So, Margins to the Mainstream had an evaluation that looked at the first 2.25 years of our project, which was the original funded period. And we had a great evaluator working alongside us doing the evaluation. as the project was implemented. And when it came to the final report, she developed 4 recommendations for Women's Health Eastern partners, but she also added in 2 recommendations for funders, which was very strategic because I think, as all of us know in this sector, those short-term funding horizons are really difficult to do the long-term work that is needed. So one of them was about long-term funding and the importance of providing that beyond, the 1 or 2 years or what have you. And the other was funding evaluation as an integral part of the project funding, which is also that part of building the evidence base.
Yeah.
And understanding, what's working in practice and for whom. So I think it's very important.
Yeah. I think having some objectives and some indicators that relate to partnership development is another way of building in some outcomes that relate to that partnership work, and that advocacy is important.
Look, I think the first thing is you have to start with the individual experiences and understand those before you can actually start to put it together. I think that's a really critical one. So that's the thing of it. It is that it's a way of thinking that you bring into all of your work. Where it gets more complicated and where honestly we are still all working out what to do is how it actually gets made practical. So any program that you're doing, you've got to bring that lens in and see how, check constantly that you're not continuing to exclude and you are, it is actually brought in. But I think in primary prevention, because so much of the work is done at that community level, that's where intersectionality, I think, really the focus needs to be. When we're working with communities, they've got their own ways of working with each other, and people shift and move, and they work within those communities. That's where we're trying to make the change. So that's where I think it becomes really important. Hope that helps.
Maureen, you all talked about partnership was fundamental, collaborative memorandums of understandings. How do you take some pressure off the champions? How do you build the champions' ability to help them create the authorising environment? I think that the skills of health promoters, I reckon, the further you get out of Melbourne, it's actually a tricky space around influence.
Just from a really practical point of view, I think it's also using the leaders of organisations who are already on board to connect with the other leaders. Like, how do you get the CEO of Women's Health and Wellbeing Barn Southwest to then meet with the CEO of your organisations, the directors to meet with directors, managers with managers, your health promotion staff to meet with other health promotion staff. And I think that's really effective. That's something I did in previous prevention of violence work, and it was really effective. I just went and, at the time, the CEO harassed all the other CEOs, our directors harassed all the other directors, and eventually it worked.
Yeah.
You plan for it.
Yeah, you plan for it, yeah.
It's something that, I've worked in the LGBTIQ space. We have experienced some of the most vile and disgusting backlash of recent times. And you take it into account, you build it into your sense of workforce wellbeing, and you constantly look for positives and you look for solidarity.
Say that the main approach and what we really tried to focus on was collaboration. Collaboration is the key for us when we implement projects, and when we say collaboration, it's actually collaboration with service provider, but it's also collaboration with communities. And so we established an advisory group with a service provider from the 5 LGAs targeted. This advisory group, like a lot of advisory group, was actually here to support, to advise, and to provide feedback. When implemented, like I say, a way for us, an important approach is actually capacity building. So we were doing capacity building of both the service, but also the communities. And I would say another thing which is important when we implement projects, and which is actually related to what we mean by tailoring activities, data collection and evaluation. because actually tailoring activities is an important way to do it. It's actually to learn by experience. And so we try as much as possible to do ongoing evaluation. And so we actually build a capacity on prevention of violence against women through 3 of our modules. One which is about healthy relationship, one about gender equality, and one about prevention of violence against women. And like you can say, some of the quotes of the women that just attended the session was, after attending this session, I feel more confident in navigating support services, which is actually the goal of our work. We also work, so we service providers, so more than 200 staff from relevant family violence, sexual assault, health and community service in the 5 LGEs attended our training. So that was training about culture, gender and race, and also some training about intersectionality. And then because COVID hit, we also had to change and adapt a bit our activities. And so we decided to actually develop some lasting resource for the professional. And so we did a podcast that will be actually a resource providing some insight when you work with cultural and diverse communities. And so it's actually set podcast where we discuss with some health educator, with some community leader, and they give us tips on how to work with communities. Okay, next one. It's about the finding and what we actually notice. I assume in regional Victoria, when you are from a migrant and refugee background and that you are a woman of color, you are extremely visible. And so you are extremely visible because the community is very small. But at the same time, you are very lonely. And what is complicated is because the community is so small, sometimes you just don't want to report or you don't want to go to the services because actually you don't want stereotype to be against your community. We have, when we implement PIVO initiative, we have to make sure that we rely on local knowledge. There is community leaders, and actually it's important to be aware that lived experience is actually an expertise. For us, it's the key of the work is actually to have a workforce which is bilingual, which actually understand really the context and can also frame, the issue for people to feel that it's actually talking to them. So the first one is always safety first. What we mean by that is like when you work in PIVO, you have to make sure that there is a comprehensive safety plan. It's about making sure that you involve people in the design, of the safety plan. Partnering with experts. Like we said, it's about equitable relationship. It's making sure that in the community you really go for the good organization. So actually I think it's important to implement projects that are evidence-based. Last but not least, don't try to be everything for everyone. So we can't do a campaign about prevention of violence against women that's just actually gonna touch everyone. Like you have to really focus on the community you decide to work with. And so I would say it's about making sure when we work with a multicultural organization that we remunerate them. Because so often actually we work with them and we do consider that it's okay to make it a volunteer way. I think also it's about if we want to involve them and if we want these communities to come around the table, it's like how do we enable them to do that? So it means thinking about transport, thinking about childcare, thinking about actually paying an interpreter. When we think about communication and social marketing, I think what is important is to make sure that actually what we do does not harm or does not reinforce some stereotype. Last but not least is about self-reflection. And we actually self-reflect on our organization in terms of the kind of activities we provide, the way we work with communities, but also about our own diversity and our own inclusion.
Sometimes consultation and co-design are used interchangeably, but they're very different processes. So I really encourage people to call consultation. We found in our practice, co-design really is a back and forward process where people with different knowledge and different expertise and lived experience work collaboratively.
And a lot of that is, trying things out. It's not a linear process. You need to allow time. You need to share power, enabling people with lived experience to take the lead. So staff and organisations need to come prepared to make changes and willing to be open-minded rather than having, a rubber stamp approach. And we talk about feedback loops. It's really important to close the loop and provide that feedback to the people who have given of their time and commitment in consultation to say, we've taken this away, we've done something with it, this is what we've done, what do you think of this? This year the experts group have worked with Women's Health East staff to develop a guide on consultation and co-design with women with disabilities. Equality is asking us to dance, not just inviting us to the party. So this is really a message about the importance of avoiding tokenism, the illusion of being consulted. As the expert says, it can be harmful. It can do a lot of damage to the women involved, and it's not productive for your team and your organisation. The Project Experts Group, you can see, is a really important part of the project. We started advertising for women who were interested to be part of a group. Initially, the focus was on skill building activities and really giving a chance for women to learn more about gender inequality, preventing violence against women, primary prevention, talking about disability, ableism, etc., and really drawing on their lived experience. That was a really important foundation. And in 2021, the group moved into co-design of resources, and I'll give you a bit of an introduction to some of those shortly. We did something we called seed grants, which provided resources to 2 organisations so that women with disabilities in the experts group worked closely with them in a meaningful consultation process. So to talk about meaningful consultation, to help them revise some of their current training offerings. And that was a really important opportunity for learning and deepening the work. And social marketing and awareness raising, and we focused in on the 16 Days campaign in particular. And these messages were co-designed by the women in the experts group. So there was a really strong emphasis on changing that typical representation that we often see where women with disabilities are represented. It's typically a woman in a wheelchair, and that's it. So we've really tried to challenge stereotypes in the images that we've used. Putting in place supports and thinking about how we could make materials and discussions accessible to them. The importance of being in a safe space, to have that safety with the group and to feel they're able to share their lived experiences when they wish to in a way that is helpful to them and takes the discussion forward. It's a process, and you need to allow time for women to reflect on their experiences, to reframe it not as an individual fault or something they did wrong, but a result of social processes acting on them.
Within our strategic plan, we have a really specific and distinct commitment to intersectionality, and it has 3 key elements. So the first is working to deepen our understanding of the family violence evidence base. The second is building coalitions and partnerships for action. And the third is engaging in critical reflection. Within this, we talked about intersectionality as both a lens and an approach. And essentially, this means looking at ensuring that primary prevention programs, systems and policies recognise and address multiple forms of oppression. There's a key focus in our strategy of building ongoing partnerships and relationships with community-led organisations. And this is actually the key way that we think we can integrate understandings and meaningful action into all of our work while working in solidarity with those communities
to create change that addresses the other drivers of violence in addition to the drivers of violence against women. So there were 3 key parts to our ongoing commitment to intersectionality in primary prevention. The first was looking at understanding. So how systems of power, privilege and oppression shape people's experiences and how to transform these. And I think the really key thing here is that a lot of the data and the evidence that we have won't necessarily immediately at the first read tell us what we need to know about the experiences of a range of these communities. Marginalised communities aren't always visible in research. They aren't always visible in our communities. So we have to make an extra effort to understand and to make those experiences, bring those experiences into our understanding and our knowledge. The second is looking at action in solidarity and in partnership. And I think the really key thing here is the need to centre the experiences of marginalised communities. And this means transforming universal approaches and all of our programs and messages, but also advocating for activities with and for particular communities that are led by them. These long-term partnerships and relationships are really about a key way for us for us as an organisation to enact our commitment to intersectionality in practice, as well as practical collaboration, but the focus was actually on the relationship and the relationship beyond individuals, so that it wasn't reliant on one person knowing one person. And actually we've had staff go backwards and forwards, including me, between the different organisations. There was also really a key need to address the tensions that existed around the issue and between the organisations directly in a way that was open and constructive. And one of the things that we did was we then wrote up that process with our partnership broker, and we put that out as the Pride in Prevention Partnership Guide that was launched last year. And I'd really encourage you to have a look at that guide, whether you're considering formal brokerage or partnerships or not, because there's a lot of stuff in there about how to initiate and maintain relationships with community-led organisations. The key lesson, if I were to boil it down to anything that we learnt through this process of this partnership, was really around the question of leadership. So the thing here is about, in terms of intersectionality, is about leading with and not for marginalised and excluded communities. So not stepping out in front and doing it for them, but bringing them with you, next to you, pushing them forward, bringing them to the table. What this means in context often has to be negotiated, and there may be times when a mainstream org needs to step forward or when it needs to step back and push other people to the table. And really what you're doing throughout this process is striving for an equitable relationship while acknowledging that there will be differences in power between organisations. And you have to do this really consciously and with openness to feedback and connecting consistently around this over time. It's about centering the voices of priority communities and combating exclusion, invisibility and marginalisation. So the principle that we talk about here a lot is nothing about us without us. And it's an important principle, but in practice it's really important. It's very hard to build programs that are for particular communities if they're not involved. They're just never going to be as good. Intersectionality is more than representation. It needs to be about understanding and it needs to be about transformation. So it's representation for a purpose, not a ticker box of identities or categories. And a critical question here is what happens when people aren't in the room? How does that reinforce experiences of invisibility, exclusion and marginalisation? Consultation can also be a really important thing to undertake, but it has to be meaningful consultation. And here a couple of pointers, I suppose, in terms of doing consultation. It has to be genuine. You've got to be willing to actually change the thing that you're asking for feedback about. It has to be timely. I've been asked to consultations before the night before. That's not great practice. You've got to give people time to actually provide feedback if you're seeking it. It's got to be specific and transparent. So ask specifically what you want the feedback on and what you're able to change, and make it clear what's not up for negotiation and isn't possible to be changed. It needs to be responsive, so you go back to people and say, hey, that feedback was great, we've changed it because of the input that you made. It has to be paid where you possibly can. If you can't find the advocates and the community-led organisations on the ground, what can you do? Look at research about priority communities. Often you will have research about particular communities that, like I said, break it down and show you about their experiences in rural and regional areas. So look to research and find out about the experiences of communities in your areas. You can reach out to the statewide orgs to see if they know anything that's happening in your areas. Another thing is, when you're embarking on this kind of work, is to really be prepared to admit when you get things wrong, where you do accidentally reinforce an experiences of exclusion or invisibility or marginalisation, and to be serious about a process of accountability and repair where you may have accidentally or inadvertently done that. Another key thing is continually being open to making unconscious bias conscious. Now that's a big sentence, but I think you get what I mean, in that we're all, we weren't born racist, sexist, homophobic. We're taught to do this over our lives, and we're constantly unpicking that and making ourselves aware of what that experience means for the range of communities and people that we're working with. Another key thing is about looking at processes, not only your aims. Sometimes the processes of doing your work, they're built for a dominant culture. Don't be put off. Try something small, then try something bigger. Celebrate your gains along the way, and just keep at it.